Everybody is, talking about it, but they're not giving any attention to this problem which we are facing today. We'll start our little talk with story by Acharya Rajneesh. I'm sure people know him. There was this circus in the town, and the circus manager had a great passion to collect peculiar things. अनोखी चीजें इकट्ठा करना उसका मतलब था. So one lady came with a basket and said, I have got a small dog which plays the piano. So he said, Aiye, andar aiye. He took her inside, made her sit there. Then she took out from the basket a dog and a small puppy, and the puppy started playing the piano. He was thrilled. The moment this puppy started playing music, another dog came from outside and took the puppy away in its mouth, along with the piano. Manager said, what is this? Ye kya ho raha hai? So the lady said, the one who had got the puppy, this is the dog's mother. She wants him to become a doctor. ये कुत्ते की माँ है, वो उसको डॉक्टर बनाना चाहती है. So I hope I have answered your question to some extent. I will not answer everything. I will leave some things for you to think. So the lady said, this is the dog's mother and wants the puppy to become a doctor. If we need to transform a surgeon into a successful cardiac surgeon, we have to have a surgeon first, and he should be willing for transformation. If you give time, the ugly duckling will become a swan, no doubt. But unfortunately, that is not the case with us. If you think, oh, with time I'll grow up into a swan, you're mistaken. This topic is very ironical. If you see in the state of Uttar Pradesh, we have got very few MCH candidates. If you take my institute, nobody has joined. It is such a big crisis we are facing that we do not have takers for this particular seat, particular course, particular profession. What is the cause? Whom to blame? We'll gradually come to it. My apologies to anybody in the audience who may disagree with me. Feel free. I have got nothing against it. I am entitled to my opinion. You are entitled to your opinion. Now the talk becomes very interesting. I want your 100% concentration. I studied in a school in Bhopal, and the vice principal and the principal, half my knowledge is, my sarcasm is from them. So this vice principal went to the principal and said, Father, you know, Miss Rita Fernandez, whenever she enters the class stops breathing. So my principal said, oh my God, she's so strict. No, she wears such tight clothes. She wears such tight clothes that the entire class stops breathing. So this vice principal of ours gave us a book, What Kate Did at School. This was a book in 10th standard for us to read for rapid reading. You have to read it in a week's time and then you have to present it. And we were very naughty boys. So on the first page of the book, this is all what we wrote. Please read it. What did Kate do at school? Everything except study. School? She never went to school. Exactly opposite of what her mother told her to do. Spent all her time with the boys. She did not do a thing. Everything else did everything for her. These were the comments written on the first page of the book. And they all went to my vice principal. So he called us on Saturday afternoon and he said, no, what she did at school was study. And this is what is missing today. He said, I still remember clearly, she did everything, but she did everything after she did her study. And this study is what is missing after 50 years also. I have not forgotten my vice principal. He said, you do whatever you want, but your first job is to study. And he said, what Kate did at school was study. And this is what is missing. We are doing everything except studying, and everything else comes after that. He's so right. So the important corollary to this is what? The boys on the street who cannot read and the boys in the school who will not read. No difference. A very bitter statement. It's applicable to everybody, all of us. A boy in the street who cannot read and the boy who does not want to read, there is no difference. A very, very bitter statement. Now, study does not mean you open your book and read till midnight. You can download the entire Kirkland Perloff on your laptop and you think it will get into your head. No, study means it's another word for learning, understanding, growing, maturing, and ripening like the fruit. You have to imbibe everything possible. And that is what is study. It does not mean open your book and you read till midnight and you say, I have studied. No, study has to be taken in a sense that you imbibe everything possible to become a better student, a better citizen, a better teacher, a better surgeon. All of you must have read Alice in Wonderland. Alice is lost in the woods, and then she reaches crossroads. Chaurahe pe pahunchti hai, and she doesn't know where to go. So this Cheshire cat is there. So Alice will ask the Cheshire cat, which road do I take? Which road do I take? So the Cheshire cat says, where do you want to go? Where do you want to go? So Alice says, I don't know. Then the cat says, you can take any road, it doesn't matter. If you don't know where to go, any road will take you there. If you don't know which road to take, any road will take you there. But if you know which road to take, you have to take where to go, you have to take that specific road. This Alice in Wonderland, I have never forgotten this particular bit from Alice in Wonderland. A very, very important lesson. Which road if you don't know where to go, any road will take you there. So this one word, where to go, says it all. This where is very important in life, whether you're a teacher or you're a student. If you don't know where to go, any road will take you there. Please keep repeating that. Whatever progress you want to make, this where is very important in your life. If you don't know where to go, any road will take you there. Now, once you decided where to go, forget about the small things. Who will get the credit? Who will take the blame? Who will get the benefit? Who is the loser? These are all insignificant issues once you have decided where you want to go. The pot calling the kettle black. The pot calling the kettle black. This is the present concept. Oh, students padhna nahi chahte hain, they want to study. The students say the teachers don't want to teach. Both are equally black. Whom to point a finger at? This blaming game, the pot calling the kettle black, I'll come back to it in a few minutes. See, once we have decided where to go, then that should be the goal. We all get diverted by smaller goals, and this is what is written in the Bhagavad Gita. That what stands between us and our greatest goals are not obstacles, but clearer paths to lesser goals, shortcut. Kam chal jayega. Chalel, parvaile, all in every different language means we'll just do what comes without getting to the major goal. We take the lesser goals and the easier pathways rather than doing something which will last for a better, bigger goal. And we wander away from our goals, sway away from what we have to achieve. Now we'll have 1 second break. I'm going to show you the next slide, which is the gist of my topic. This is the father and the son flying a kite. And then the little boy wants a kite to fly higher and higher, nothing unusual. The father and the son have a fight. The son says, let the thread go, only then the kite will fly higher. You are holding the kite down, the child screamed. The father said, no, If I let the thread go, the kite, that is, the thread is keeping the kite up. The thread is keeping the kite up. And then the boy got very angry, like all the young blood, and he snapped the thread. Shantanu, what's the problem, Shantanu? So the little boy snaps the thread. And then you know what happened? This is what happened. They were flying a kite. The boy says, you're holding the kite down. The father says, no, I'm flying the kite. And the boy snaps the thread. And this is what happens to the kite. No matter what type of best manjas you have got from anywhere in Bombay, Gujarat, but still the kite lands upon a tree on an electric pole. This picture of flying a kite teaches us a lot. If all of you just concentrate on the picture, it will teach you a lot. The kite is your career flying high up in the sky. The spool that the thread is there is the entire CPU. The thread is your discipline and passion. The more the speed of the wind, the more the resistance, the higher you fly. It all depends on you. Your movement will decide how your kite climbs up in the sky. The entire training program can be oriented to the small basic technique of flying the kite. A lot to learn from this. If you have understood this boy flying the kite, transforming a surgeon into a successful cardiac surgeon is given only in one picture. This is Anthony de Mello, one of the Society of Jesuits priests who has written wonderful books. He writes, wisdom tends to grow in proportion to one's awareness of one's ignorance. If you know where all you're lacking, you can improve. See, the story of the kite and the father is nothing new. If one understands, the thread which is holding the kite up is nothing but discipline. I repeat, the thread is nothing but discipline. What is discipline? The commander in the army shouts, attention, and the entire army falls in order. That is discipline. Agreed. All the children walking in a line to go to get food in the canteen is also discipline. You following a particular protocol in the theater, following a particular order is also discipline. Somebody wants to start round at 7 o'clock is also discipline. Discipline only means that a particular way of doing a thing which suits you and you follow it. That is what discipline means. Doesn't mean put your finger on your lips and sit in the class. If you want your kite to fly higher, you can't get the ISRO to launch the kite there. You have to assemble everything and climb meter by meter until you reach high up in the sky. I repeat, meter by meter. Every day you attend your class, every day you learn something, every day you operate, you're going a step higher, you're going a meter higher in the sky. The ISRO will not launch you there in the sky. You have to go up yourself. See, we are not discussing careers, but what I mean to say is that whatever you want to achieve in life, you have to gradually climb up, work hard, and achieve it. In 1988, when I was a trainee, I took 3 days leave and went to Nagpur to meet my father. And he took me to Dr. S.B. Joshi, who was the surgeon, those days FRCS. He said, Hare Vinayak, you're doing MCH cardiac surgery? You've taken 3 days leave? Who gave you leave? He said, as a registrar, don't take a single day's leave because you may never see those things again. I understood what he was saying. I felt very embarrassed, but that certain thing has changed with time. Those days, to get one potassium value, we had to ring up for 10 minutes, 15 minutes and get it from the lab. Now you get it in 2 seconds on the computer. Those days, the numbers of cases were 200 a year. Now the centers do 1,000 cases a year. Those days we had 1 registrar. Now we have 5 registrars. Everything has changed. So the registrars to say, oh, I worked for so many hours, my registrar should work that much. is not correct. Is not correct. I fully say they should be given free time. They have got to work, but work means work. And when you finish your work, you go, because now all the gadgets are on the phone. You want a reference, you get it straight away. We had to go to the library to get a reference. You have everything accessible to you. So you make full use of your time, and the rest of the time you relax. We have got no problem. But I still remember Dr. Joshi telling me as a registrar, don't take leave, because you will never see those things again. So what he was telling me was, the more I put in my CPU, the more thread I have, the higher I fly. After doing 500 cases, Dr. Prasanna says he can repair this valve. Somebody else says he cannot repair the valve. Why? Because he has been gathering that much experience. He has put in that much effort. He has taken that much pain to understand. That is why in his hands he can repair. In your hands, it will be a failure. So that much effort he has put in, and there is no substitute for this particular hard work. So what is lacking today is discipline and passion. We have to blame ourselves only for this. In this specialty, we get the last 2 students in the 3rd mop-up round. Just listening to that, I feel dizzy actually, that what a stage we have reached, that the students are not taking up this specialty. We have to blame ourselves for this. You go to the exam and you get a question, TA PVC 20 marks. And the fellow is writing for 20 minutes that answer. What all he has to write, God alone knows. He writes horizontally, the examiner reads vertically. Now, how to pass that fellow? A better question will be, discuss the levels of obstruction in TA PVC. That is relevant to what he can explain to you, rather than giving him such a broad question. And then during the exams, what happens? The candidate is passed because he's worked very hard. The internal examiner will say, who said this is going to be easy? Super specialty means it's hard work. He has not done anybody a favor. It is expected of him. He needs to know the basics, especially when everything is online. He cannot say, no, the internal says, oh, he has worked very hard. And then the other side of the coin, the other candidate has hardly worked. The consultant of the unit wants to get rid of him. So what happens? Both the candidates pass. One who has worked very hard, and the other one who has hardly worked. So both have been passed. And what happens with them? Very similar to the kite which has no thread attached to it. Very similar to the kite which has got no thread attached to it. Other than the unit saying, oh, we have passed all 5 candidates, what else have we achieved? We have achieved nothing. I request all of you to find out what happens to these people when you leave them like this. Where do they go? What progress they make? What happens to the department? What happens to the particular specialty? I really don't know. And this is the cause of our present plight. The main goal is lost, and we are taking up lesser and easier goals. When we shift out our focus from what we have to achieve, we land up in this sort of a situation. The kite without the control on the thread is like the kati patang. Where it will land depends on its fate, on top of a tree, electric pole, or someone else's terrace. Wherever it lands, it is of no use. No effort. See, if we go around, you'll find many people like this, and we have got to make improvement in this particular aspect. The railway ticket joke. My registrar came early morning gasping for breath and said, sir, I want to go home. There's an emergency. I said, you need anything better? Your tickets and all that. Yes, sir, I've got my ticket. Show me the ticket. And when I see the ticket at the bottom, the date of booking is given there. If you see the railway ticket in small, minuscule lines, when it was booked a month back. So what I'm trying to say is that honesty is required in this specialty, any specialty for that matter. You can't cheat. Discipline, and second comes honesty. I had another very sad experience. Somebody rang up and told me, this is the anatomy findings. The child is diagnosed to have TOF, and what have you done? I did a Glenn shunt for the child. Now you tell me, is this correct? We have to admit that we cannot know everything. Most important. It is better to send to somebody who does this regularly rather than opening the child and for a TOF, a biventricular repair, you do a Glenn. Tell me, is this correct? And this fellow has spoken to me on the phone and said, "Arey, maine Glenn kar diya, sir. Main kya karta aur?" Very wrong. I felt very bad. Vijay, who's sitting here amongst us, I went to him. He's like a son to us. I went to him to learn the Ozaki procedure. If I had given him one phone call, he would come and say, "Sir, I will teach you." He's my student. But I said, no, I'll go there. I learned and I came back. And then when I at my stage can go and learn something, then I find no excuse from anybody else to say, "Ye meko nahi aata hai." If you're interested, go learn and come. Why don't you want to pick up something from someone else? Vijay taught me Ozaki. I've come and done 6 of them now. I'm very proud. So when I can learn at my stage, when I'm 64, 65, I'm sure all of you are younger to me. What needs a lot of, this needs a lot of passion and discipline in order to scale higher and higher in the sky. Without passion and discipline, you can't scale higher. 100% effort gets 100% results. If you say, "I'll put 50% effort," 50% effort gives you 0 result, does not give you 50% result. Now, the other aspect is that the stress of the specialty, when you're operating, I've given all this thing, what goes on in the surgeon's mind. If he's standing on the right side, everything goes on in his mind. If he's standing on the left, he's worried about what time the cafeteria will serve hot dosa. The fellow who's operating, he has to go through this complete stress. So it is a stressful job. And what are we trying to make? We are trying to make leaders out of our trainees slowly because they have got to lead the theater. Unlike other theaters, this thing is one person oriented theater, only one pilot, only one commander in the theater. And I'm very, very particular about this, that you stand there and you give commands and you take over the leadership. Like the seed, if the seed wants to become a tree, it has to give up its existence as a seed. You cannot be a seed and you cannot be a tree. Either you become a tree or you become a seed. Either you follow the sutures and push trolleys and take the patients, or you become the surgeon and start giving commands. You cannot have a dual existence. So my suggestion is, please grow into a tree. Give up the existence of a seed. Only then can you can be of some use to society and carry on the legacy that has been imparted to you by your mentors. I had one surgeon, and in that surgeon was the theater used to be called a shrine because everybody in the theater is praying. So I said, "Oh, that's a very good thing. Why everybody is praying?" So they told me, "We are praying to Almighty so that he can finish the surgery fast. We are fed up." So we should not have this sort of a surgeon that everybody is praying for the surgery to get over. I hope you have got the message. Because why? He has never given time, never disciplined himself, never thought that he should do better, never has thought he has to do his best. And he has to, it has to come from inside that I have to perform better. No wonder everybody prays for him. When this topic was assigned to me, I sent out my feelers to everybody. Everybody has contributed 2 to 3 slides. This was given by Ram Prasad from Madurai. He says, technical skill is most important. You have to have years of training and practice. Then knowledge. He said, you have to have a good grasp of the subject and you should be willing to update from time to time. That is why these CMEs and workshops, you must attend. It's not the question of me making fun of Shantanu or making fun of somebody or talking and, laughing and eating and drinking. But you attend because you will learn something more. Even if mitral repair you have done, you go and attend Dr. Prasanna's class or somebody else's lecture, you will learn something more from his point of view, which you did not know. So it's very important that you have to constantly keep learning. Decision-making skills. This, at the spur of the moment, you have to decide what is to be done. And this comes only with your experience. How much thread you have in your spool, how much memory you have in your CPU. Otherwise, you can't do this. Communication skill. This is a must. When you are standing on the right side as a leader, when you say something, the entire theater should fall in order. I'm assisting so many of these boys to operate, but I never open my mouth loudly. I prompt the surgeon to give a command. Come on, Roy, tell them to go on pump. He'll say, okay, on pump. But I never give a command. I make sure I train the person to grow. This is very important. Whenever I'm sure you'll land up into problems, complications, and you will be fed up. You're so tired, you don't know what to do. But you have to put all this at the back of your mind and proceed. Resilience is very important. You can't run away from. Sometimes you're just fed up. You say, okay, declare karo, mara usko, meko ghar jaane do. No. That is the time when you should put in all your effort, call help, call somebody, speak to him. The other day I had a problem. I rang up one of my students. I said, this is the problem. He said, no, sir, you do it this way. I did. The patient went home. So you must always do this. You have to have, look, whatever complication, put it at the back of your mind and proceed. And the passion. You have to have a big passion for this. Mujhe ye karna hai. Till this passion is not there, whatever I say is all going to go waste. And a commitment to lifelong learning. Every day you should learn something. Every day you should teach. What happens with this? The day you think you know everything, your downfall has started. At one stage in CMC hospital, we had a very high mortality for aortic valve. Stanley John continued to operate. I always say we lost 22 patients in a row. For Stanley John, Vivek is laughing here. 22 patients in a row for aortic valve loss, but he never gave up. He kept looking, kept looking, kept looking. We had the bottle with the pressurized thing and the cardioplegia going by that. Then we changed to St. Thomas's solution. Until today, we don't have a problem for aortic valve. So what he did, not that hats off to the man. I've got great regard for him and Dr. Jayaraj. But those 22 deaths, he put at the back of his mind and he said, where is the problem? What is the problem? Then he started St. Thomas and our patient started going home. What a wonderful thing. This is Pankaj Kaul, one of my colleagues, classmates. And he sent this. He said, we have to be very methodical, logical, and not given to impulsive decision making. And when things go wrong, as they surely will do at times, you get progressively calmer and you think, he said. And this is the quality which Stanley John had. You get progressive calmer and think. You can then think better with all your vast experience and knowledge, and you can bail yourself out. A combination of technical skill, flawless surgical temperament, and inexhaustible endurance. If you think that you can do just 2-minute, 5-minute procedure, take the money and go home, no. You have to have an inexhaustible endurance. These are some other slides given by the other persons that, the institutes want to fill up seats. There's no scrutiny. I went for one exam and one candidate came and he's telling me, I said, what about the left to right shunts? He said, sir, my congenital heart surgeon is absconding. The student is telling me, I said, you cannot talk like this. You can say, sir, we don't have a department to run congenital heart, but don't say that my surgeon is absconding. I said, for that particular answer of yours, you will have to take the third exam from today. So we don't want such things. We have to have a proper enrollment for these particular institutes. Then all these other points have been given. The third point, unsure financial stability. This financial stability, in my days, I was getting a salary of 643, which was enough. But now the registrars need to be paid. They have got their wife, their child, their parents, their housing, the accommodation, everything to be looked after. For heaven's sake, don't say that I got this much salary, so they should be paid less. No, they should be paid more because they are the ones who are running the whole show. They, registrars, if you pay them well and treat them like registrars, treat them like proper persons, like young doctors going to become the surgeons for tomorrow, pay them. We cannot deprive them of small pleasures of life. We do not have a mobile, we work, but that fellow needs a mobile. You want him to come with the references tomorrow morning, he needs a mobile. Then why do you say you don't pay him? You have to pay him. The registrars should be paid nicely. So, Pandeyji, no talking. Huh? Now, the other thing are the system issues which are there, lack of opportunity, and all these things will come. But, along with this, what I have been saying is the most important one. Now, this one, I want all of you to concentrate, though you are tired. So, Buddha, so many people are listening to you, but they are not enlightened. Somebody told Buddha. So Buddha said, oh, you go and ask my students what they want. So the man went to each one and asked, and they came back. Some was there, and the replies was, some wanted to serve him, some wanted to get married, some wanted to be celebrities. Then Buddha said, see, nobody wants to be enlightened. So why are you telling me that they're listening to me and not getting enlightened? They don't want to be enlightened. So if you want to be successful, you have to say, yes, I want to be successful. And then only the transformation will start. And now this is, we have to commit ourselves to being enlightened. And this is the story for being successful. And this is the last one. Everybody wants to go to heaven, but nobody wants to die. Everyone is smiling now. You want to go to heaven, you want to die, you have to die. If you have to be successful, put in your best effort. If you want your patient to go home, do your best. And then only you can achieve, you can be successful. Only then. I cannot transform you, you cannot transform, you cannot transform any. You have to transform yourself. The day you decide that I want to become better, I want to improve, then you have done your job. And I have done my job. Thank you very much. Thank you very much for your time and attention.